Jaw pain. So what are some of the commonest causes that can cause a pain in our jaws? So the jaw pain can either be in the maxilla or the upper jaw, or the mandible or the lower jaw. The commonest reasons can be, number one, it can be a tooth pain. When I say a tooth pain, the tooth can either have a decay, so the decayed pain can not only hurt the tooth, but it can also look like it's arising from our jaw, and our entire jaw can pain because of the decay in the tooth. So this is one of the reasons. The second reason is when our wisdom tooth erupts, or for that matter any tooth when it erupts, can trigger a pain in the jaw and then cause a radiating pain which can extend to the jaw and to the neck also. So a tooth pain can refer to the jaw and cause a pain in the jaw. This is one of the commonest reasons, tooth pain. The second reason is anything to do with our sinus. Our upper jaw has got an air-filled cavity called the sinus. It's called the maxillary sinus. So sometimes any inflammation in our sinus can look as if our entire upper jaw is paining. So a sinus pain can actually mimic a tooth pain or a jaw pain. And I've had patients with a recent history of a cold coming to the clinic saying that their teeth are paining, the jaws are paining. But apparently when you look at clinically examine the tooth, when you take an x-ray of the tooth, they all look perfectly well. But when you ask them a question, did they get a cold sometime back, they say yes, and eventually it is a sinus pain that is getting referred to the jaw. So this is the second most commonest thing. The third most thing would be, the third reason for a jaw pain can be, it's called the TMD, it's called a joint pain, which is the temporomandibular joint. Any pain in the joint can get referred to the jaw. It can not only get referred to the jaw, it can refer to the neck. You might have some clicking when you open and close our mouth, can have pain at the angle of the mandible here. So these are some of the areas which can hurt because of the temporomandibular joint dysfunction. This is another cause of a jaw pain. Fourth, not very common, but it's a neurological condition. It's called a trigeminal neuralgia. So it's a nerve that supplies different areas of our face. So when there is an effect of the nerve, when the nerve gets affected by, it's called a neuralgic pain or the nerve pain, can trigger, and it can get triggered by touching any part of the skin that is supplied by that particular nerve, can also cause a pain in the jaw. Lastly, any trauma or any pathology in the bone that is there can also trigger a jaw pain. So if you are having a jaw pain, it's advisable that we don't take it lightly, we don't ignore it. Take action, visit your dentist to check out if we have any decay or any TMD dysfunction, and to ensure that we solve the problem. I hope you find this video useful. If you have any questions, please do ask in the comment section below. We'll be happy to answer. This is Dr. Arun. Until next time, signing off from Pearls Dentistry. Bye bye and thank you. And before I go, if you have not yet subscribed to our channel, please do subscribe to our channel Pearls Dentistry. We're coming out with a new video every day. And we've been running our dental centers at Chennai, Raja, Annamalaipuram since the year 2001.
பண்ணுங்க, subscribe பண்ணுங்க, bell icon click பண்ணுங்க. இந்த மாதிரி videos உங்களுக்கு வரும். Thank you.